Varicose veins can be troublesome, but are they genetic? Dr. Calcagno of Calcagno and Rossi Vein Treatment Center is here to make sense of vein health. He's also joined by mother-daughter patients Roberta and Lori Benson. And thank you for being with us today.
Thank you very much for having us.
So, Doctor, last Mother's Day, around that time, I understand, we were talking about how these, new moms, having babies can cause these veins, and it's very annoying. And now we're talking about how there's a connection between moms and daughters. So tell me more about that.
Right. Around Mother's Day this year, we're looking at the equation from a different standpoint, not how pregnancy can cause varicose veins, but how parents can pass on the tendency to varicose veins to their children. If someone has no family history of varicose veins, they have about a 20% incidence of varicose veins developing throughout their lifetime.
Okay, not so bad.
If one parent has varicose veins, that incidence goes up to about 65%. And if both parents have varicose veins, the incidence goes up to about 90%.
Ooh,
so it's got quite of all the different risk factors, genetics is probably the strongest.
And women also just seem to get them more, don't they?
Right. Yes, it's kind of a double jeopardy there.
Okay. So you were doomed. Okay, you were doomed from the start. Yeah. So why don't you tell me your story, ladies?
I inherited these veins from my father. My father had them, and I looked at them my whole life, and I thought to myself, how lucky that I don't have them, until I became pregnant, and then all of a sudden I noticed them growing and becoming much more intense than they were. And unfortunately, I did pass them on to my daughter, and so she has them as well.
So you both underwent treatment to get rid of these?
Yes.
How did that go?
Actually, I found that it was it was not invasive at all. I, was up on my feet the next day doing my normal tasks. So I found that it was a very, very positive experience.
What about for you, Lori?
My experience when I would exercise before I had the surgery, and I would exercise, the pain from the varicose veins was exacerbated. However, after undergoing the treatment and having them removed, I was actually on the Stairmaster the next morning. So
good for you.
Yeah.
Feeling a lot better.
And the legs look a lot better.
Yeah. So, do you see this often, the moms and the daughters coming in, both dealing with the same things?
Yes, it's a very common pairing.
Very good. And you would do this again, of course. You said it was so non-invasive.
Yes, I would definitely do it again. And although I don't live in this area, I come to this area to have it done.
Very good, just to see Dr. Calcagno.
Absolutely.
And would you do it again, also, Lori?
Absolutely, absolutely.
Yeah. Very good. Now, if folks out there maybe are dealing with the same thing as these ladies, you have a screening coming up you want to tell us about, Doctor.
Yes, next Tuesday and Wednesday, we have a free vein screening. If people have any questions about whether they may have a vein problem or not, or want to get it checked out, just give a call. I think you have the number listed on your screen.
Yep, and so you just want folks to register so you know
yeah,
who's
call for an
coming
appointment so we have a time set aside for you.
Very good. Good information. Thanks for sharing your stories with us today,
Oh,
ladies.
it's our
Good to meet
pleasure.
you, too.